All right, let's talk about something that's incredibly common, but honestly, pretty misunderstood. We're going to be demystifying the human papillomavirus, or HPV. It's time to get straight to the facts.
Okay, I want to start with a number that's, well, it's pretty staggering. Over 80%. That's the share of unvaccinated, sexually active people who will get HPV at some point in their lives. So we're not talking about some rare thing that only affects a few people. Nope. This is, for a lot of us, just part of being human.
And get this, it actually holds the title for the most common STI in the United States. I mean, we're talking about around 13 million new infections every single year. And that massive number is exactly why it's so crucial for all of us to understand what's really going on with it.
So let's just sit with that for a second. It's an incredibly common virus. But here's the first thing you really need to know, and it's actually good news. For most people, our immune systems are pretty amazing. The vast majority of HPV infections just go away on their own. They're cleared up usually within 1 to 2 years without ever causing a single problem.
So, what exactly is HPV anyway? You see, it's not just one virus. Think of it more like a giant family, a group with more than 100 related viruses. And this is where a lot of the confusion kicks in, because different types, or strains, of the virus do totally different things in our bodies. Some cause harmless little warts, while others, well, they're linked to much more serious stuff.
And this is probably the most important thing to get your head around when it comes to HPV. Depending on the exact type of virus you get, the infection can head down one of two very different paths. One path can lead to warts that you can see, and the other, over a long period of time, can potentially lead to cancer. It's so important to know they are not the same thing.
And this chart here just lays it all out so perfectly. On one hand, you have what we call low-risk HPV. The main ones are type 6 and 11, and these are the ones that cause genital warts. The key thing here is they are extremely unlikely to cause cancer. Then you've got the other side, high-risk HPV. Type 16 and 18 are the ones you hear about most, because they're responsible for about 70% of all cervical cancers.
So what happens if that high-risk HPV sticks around, if your body doesn't clear it for many, many years? Well, it can cause changes in your cells that might eventually lead to cancer. And it's not just cervical cancer. As you can see, we're also talking about cancers of the vagina, vulva, anus, penis, and even the back of the throat.
Okay, so this is the big question, right? How would you even know if you have HPV? Let's get into the signs and how it's diagnosed, because as you can probably guess, those two paths we talked about show up in very different ways.
Well, with the low-risk kind, you can actually see the signs. Genital warts can show up anywhere from 1 to 6 months after someone's infected. They might start as these little soft growths, and sometimes they can get a bit rough and bumpy, even looking a little bit like a tiny cauliflower. They can be itchy, but a lot of the time you might not feel them at all.
But here's the really tricky part about the high-risk types. Unlike warts, the cell changes that can lead to cancer are totally invisible. There are no early symptoms. You can't see it, you can't feel it. And this right here is exactly why routine screening is so important. It's an absolute must.
So, what does that screening process actually look like? It's not as scary as it might sound. It all starts with a routine screening, like a Pap test, which looks at your cervical cells, or an HPV test, which actually checks for the virus's DNA. Now, if a result comes back a little unusual, the next step is often to figure out exactly which type of HPV it is, to see if it's one of those high-risk ones like 16 or 18. From there, your doctor might want to get a closer look at the cervix using a special magnifying scope, that's called a colposcopy, and maybe take a tiny tissue sample, or biopsy, just to be sure.
Okay, so let's say they do find something. What happens then? Let's talk about treatment. And here's the main takeaway. While we don't have a cure for the virus itself, we are really good at treating the problems it can cause.
Yeah, and I really want to hit this point home again. In most cases, your own immune system is the hero of the story here. It takes care of the virus all by itself. So when doctors step in, they're not treating the virus directly. They're treating what the virus left behind, whether that's warts or those precancerous cell changes.
So for warts, there are a bunch of options, from creams you can use at home to procedures a doctor can do, like freezing them. That's called cryotherapy. And for those precancerous cells on the cervix, well, the approach really depends on how serious things are. Sometimes it's just about watching and waiting with more frequent tests because they can go back to normal. Other times, it might involve a simple procedure, like a LEAP, to remove the abnormal tissue before it ever gets a chance to become cancer.
Okay, this brings us to what I think is the most powerful, the most hopeful part of this whole conversation. Because treating these issues is great, but preventing them from ever happening in the first place, that's a total game changer. We're talking about cancers that are preventable. That's huge.
And the absolute #1 tool we have for that is the HPV vaccine. It's recommended for both boys and girls, usually around age 11 or 12. And you might be wondering why so young. Well, it's simple. The vaccine works best when it's given before a person ever comes into contact with the virus.
You know, the vaccine itself has gotten better and better over the years. We used to have versions that protected against 2 or 4 types, but the one we use in the US today is the 9-valent vaccine. That 9 means it protects against 9 different types of HPV, which is just a massive leap forward in protection.
And this chart? Wow! It really shows you just how much ground this new vaccine covers. It targets type 6 and 11, which cause more than 90% of genital warts. It nails type 16 and 18, the cause of most HPV-related cancers. But then, it goes even further, protecting against 5 more high-risk types. All told, it covers the viruses responsible for about 90% of cervical cancers. It's incredible.
Now, the vaccine is amazing, but it's not the only piece of the puzzle, right? Safer sex practices are still incredibly important. Using condoms the right way, every time, can seriously lower your risk of getting HPV, though it doesn't get rid of the risk completely, since the virus can spread through skin-to-skin contact. Limiting your number of partners and male circumcision can also help reduce the risk.
So when you boil it all down, what's the big takeaway here? We are living in a time where we have a vaccine that can actually prevent cancer. Just think about that. It's one of the greatest public health achievements ever. And it really leaves us with the most important question of all. Knowing that this tool exists, how do we make sure every single person who could benefit from it has the access and the knowledge they need to be protected? It's an incredible thing to think about.